We've got a practice with 4 partners. 2 of us are completely devoted to doing corrective jaw surgery. And this is one area of the specialty that has the most impact on the quality of life. It's probably the most impactful thing that all of dentistry has to offer.
You can look at a before and after surgical patient. You can say, is this person, better looking, kind of more attractive? And people say yes, but that actually is not the most important thing. They have more self-confidence, and it has like a big impact on their lives. They're just perceived as different people.
I know that I can walk across the hall and ask Ben to pull the case up on his computer, and then the 2 of us can really think about it together. And I'm not making a decision in a vacuum for a patient. Having a very experienced surgeon to work with, who can also share an opinion, or provide you with some direction on a case that you're not quite 100% sure about, really makes a huge difference. When we work together, if it's my case, Dr. Walline is an extension of my hands. And when he's got his case, then I'm aiming to really be an extension of his hands.
One patient, maybe their main concern is they have obstructive sleep apnea, and that's their goal. Okay, another patient may be functional issues where their front teeth don't meet and they can't chew food and they have a speech problem. Another patient may be purely cosmetic, and that's a reasonable reason too. But ultimately, the doctor and the patient kind of need to agree that, okay, these are the goals, and if those goals are realistic, that's when we can kind of move forward with treatment.
I think the thing that really keeps me going is to get an email from a patient saying that something that we did really had a big impact on their life down the line. That's the true reward.
So I had this patient that came in, they had this really bad kind of overbite, some significant facial asymmetry. They were going orthodontic treatment, without even knowing that jaw surgery was an option. Ended up moving forward with treatment. But he started off as like kind of a 1. And he didn't go to a 10, but he went to like a 5, we'll say. But him being a 5 was like a big deal. He got a girlfriend. I don't know if he's ever had, but it was a big deal to him. He got a better job. It had like a huge impact on his life. And even years after treatment, he was moving out of town, and he came into the office and he gave everybody in the office a hug. And those are the things that validate what I do.